Alignment, balance, and Qi are essential elements in movement, strength, and flexibility. All are essential for optimum performance or recovery from injury related to automobile accidents, sports, or overuse syndrome. Hi, I'm Shelley Miller with the Healing Arts Institute in Boise, Idaho. This video is the first in a series on what I like to refer to as the ABCs of holistic health: alignment, balance, and Qi. In this video, we'll demonstrate alignment techniques that use muscle energy to pull the muscles and bones back into alignment. Balancing the tone of the muscle with myofascia techniques is the subject of the second video. In the third video, we'll demonstrate Qi exercises that are good for building up Qi and moving the Qi throughout the body. The muscle energy techniques demonstrated in this video use the strength of the muscle contraction against the bone to pull the bones back into proper alignment. I developed these stretches after a work injury and some personal stress led to chronic low back pain, fibromyalgia, and carpal tunnel syndrome. Each time that I tried to increase my activity level or exercise level, I would experience an increase in pain and have to start all over again. Once I figured out how to stay in alignment and could exercise and strengthen in the aligned position, I started to make progress. Maintaining alignment is essential for relieving stress to the nervous system, and this is a critical factor in overcoming chronic pain syndromes. The clients that I have worked with over the last 10 years who have had chronic pain have had alignment problems. The sequence that seems to work the best is to receive a myofascial massage, get an adjustment, and then to have the client do the alignment stretches along with pool therapy and nutritional support. Keeping the body in alignment requires consistent effort, at least for the first month. The body has habituated to the misaligned position, and it takes consistent effort to override that tendency of the body to go out of alignment. Once the body has been in alignment, it tends to prefer that, and when it goes back into misalignment, there can actually be an increase in pain. So the ideal time to start this program is when you have a month to devote to your healing so that you can do the exercises consistently. Right before you leave on vacation, or if you're an athlete in the middle of your training routine, is not the ideal time to start this. Choose a time when you can consistently do these exercises for a month. Start with just the first stretches. Usually you'll need to do both the neck and the low back stretches. If you're out of alignment in the neck, almost always you're out of alignment in the low back as well. Gradually increase to adding the additional stretches and strengthening exercises. These stretches should be done 4 to 6 times a day, in the morning after a warm-up exercise or a warm shower, in the evening, before and after exercise, and then after prolonged periods of sitting or standing. Start with these exercises, do them gently, and tune into your body. Before you start these stretches and exercises, it's important to have an evaluation with your chiropractor or therapist to determine which stretches you do first and in which order. The order is essential for the proper performance of these stretches to bring the body back into alignment. None of these stretches should cause pain. Pain is a contraindication, and you need to go back to your therapist if you're having any pain with these stretches. Watch this entire video, then rewind to the beginning of the next section. Correct posture is essential before starting these exercises. Not too much arch, not too flat. A little flex in the knees. Go through a range of motion, find the most comfortable position. Then set the abdominal muscles, like you're blowing up a balloon, and you're ready to start. Begin by checking the alignment at the cervical area. Flex forward, extend backwards, only as far as is comfortable. Here it's seen from the side, with my fingers at C6. Extend backwards, check at C2, extend backwards, again, only as far as is comfortable for you. With my fingers in this position, you can see when I go into flexion, they move slightly at C6 and C7, but not very much. When I move my fingers up to C2, you'll be able to see a little bit more difference between my fingers. I can feel this difference, and I know that I'm out of alignment. I check in flexion, and then I'm going to check in extension. I can feel that my fingers move differently from side to side. One moves up and one moves down. And you can see that little bit of misalignment as I remove my fingers. This is the improper way to bend the head forward for the alignment stretches. Instead, retract the chin, tuck it, and then tip forward vertebra by vertebra until you get to C6 and C7. Then press into the hand. Usually you go to the left first. We'll do 3 contract, relax stretches to the left. Press into the hand, hold for 4 to 6 seconds, relax and rotate. Press again, hold for another 3 to 6 seconds, relax and rotate, tucking your chin each time. The ear should go towards the shoulder each time you rotate, and then you're ready to go to the other side. We'll do 3 contract, relax stretches to this side as well. Press into the fingertips, hold, relax, and rotate. Press, giving yourself resistance, relax and rotate. Press, hold for 4 to 6 seconds, relax and rotate, finishing with a rotation over the shoulder. You can then recheck your alignment to see if the fingers move in flexion or in extension. If your fingers still move differently, you may need to repeat this process. For lower body alignment, we will begin by checking the hips. My right side is low, which means I will start my stretches on the right side with my right quadriceps. Also check to see which hip is rotated posterior. My left hip is rotated posterior. Set the abdominals before you start. To do this stretch, put one leg over the other at the knee and then stretch forward. This stretches the hip rotators. Take in a couple of deep breaths and stretch a little further, and then change legs. Bring it forward as far as is comfortable, relax, and then stretch a little further. If your hip is rotated posterior on the left, then turn on your right side for this next stretch. Put the left leg over to bring the left hip forward. Again, as far as is comfortable, keeping your left hip straight up. Don't let the hip go forward. Turn over on the other side if your right hip is posterior and stretch the right leg forward. This stretch is done only to one side, the side that is posterior. Put that side up and then stretch, keeping the hips straight. This is the figure 4 stretch seen in a sitting position. Stretch forward, keeping the back straight and in good alignment. Breathe and relax forward a little further. Not too much stretch on the back, just so it's comfortable. These stretches need to be done 2 or 3 times during the day, and this is a very good way to do them at the office. This stretch opens up the hips, and then we're ready to do the quadricep stretch. Start on the side that is longest. Starting with my right, bend the knee forward and stretch the quad. Don't put so much arch in it. Stand up straight, stretch the quad as far as is comfortable. Contract against into your hand, give yourself resistance, relax, and then stretch again. Resist for 6, relax, and then stretch. Resist, relax, and stretch. When you're standing on your leg, be sure to stand straight. Don't let your hips slide to the side. Stand up straight as you do your stretches, holding the abdominals tight. Stretch the hamstrings by placing them on a chair. Tuck the abdominals in, straighten the back, bend forward straight from the hips. Press the foot into the chair, down towards the floor. Contract, hold for 6 seconds, giving yourself resistance with the chair. Then relax and stretch forward a little further, only to your tolerance. Then we're going to stretch the other side in the reverse order, hamstring and then quadriceps. This change of order puts a different torque in the hips, straightening out the high hip and low hip difference. I'm pressing my leg down into the chair, stretching forward, giving myself resistance, holding for 6 counts, relax, and then stretch. Very gently, then contract, hold for 6 seconds, relax, and then stretch forward. I'm stretching the left leg. Seen from the other side, I'm stretching the left quadriceps, reversing the order from right to left. Give myself resistance, contract, hold for 6 seconds, then relax and stretch the leg a little bit further. These stretches should be done slowly and not too vigorously. Overstretching can cause pain and increase of symptoms. If you have trouble reaching your foot, use a strap. A tie works very well, and do the stretches with the strap. Again, contract, relax, and then stretch. The next stretch is for the psoas muscle. I'm going to bring my knees to the chest, then gently lower my right leg till I feel a good stretch. Then I'm going to lift, hold for 6 counts, relax, and gently let the weight of the leg stretch the psoas muscle. This stretch is done primarily on the side that's most restricted. Your therapist can help you determine which side that is for you. Each time I stretch the leg, it goes down a little bit further. Contract up, relax, and then stretch down. When I change legs, you can see that on this side, the leg is already at the same level where I finished with the other leg. So I'll only stretch this one once or twice. Contract, relax, bring your knees to the chest, and integrate. These are the basic alignment stretches. There are additional stretches and exercises for other postural problems, such as forward shoulders. This stretch for the pectoralis muscles can be done in a doorway or against a wall. Stretch forward as far as is comfortable, being careful not to overstretch. Holding your abdominals tight and stretching always in good alignment. This can be done from both sides. Gently stretch, rotate, take a deep breath, and stretch a little further. This stretch is for the trapezius muscle. Sit on your hand and then stretch the head to the opposite side very gently. You can give yourself resistance trying to straighten your head. Hold for 6 seconds and then relax and stretch it a little further, tuning into your body, stretching only as far as is comfortable for you. Relax, breathe, stretch gently. You can do this stretch to both sides. I'm demonstrating just one side here. You can stretch the pectoralis muscles by laying over a bolster or a rolled up towel or blanket. You can do this stretch one side at a time or both sides at the same time. Resistance here is gravity. Relax and let the arms stretch downward, taking in a deep breath and relaxing. You can also stretch the neck by laying the bolster crosswise. Stretch the skin of the neck down, pulling and then stretching the chin upward. Pulling down again with another breath and stretching the chin upward once more. It's an excellent stretch for the deep muscles of the neck. Relax and stretch gently. After the stretches, we're going to start the strengthening exercises. We'll start with the trapezius muscle. Lift the shoulder up towards the ear. This is done on only one side, the low side, which for many people is the right side. My shoulder is low on the left. I would strengthen my left side of the trapezius. Tighten the abdominals, pull the shoulders back and lift. This exercise is great for strengthening the shoulder muscles and improving posture. Relax, pull the shoulders back and lift. Hold for a couple of seconds and then relax again. Don't arch your back, tighten your abdominal muscles and stand in good posture. The next exercise is called the airplane. Lift the shoulders and the legs, only as far as is comfortable for you. Hold and then relax. Turn your thumbs out and you get more of a strengthening exercise on your lower trapezius. This can be done without the legs as well. Hold and relax. The next set of exercises are essential for correcting the high hip imbalance. On the side with the weak hamstring, do hamstring curls. Contract and hold and then relax. You can use resistance, ankle weights. A rubber band can also be helpful. Do this just on the low side, which for most people is the right side. This will help to balance the strength of the quads. On the left side, do just the quadriceps. Contract the quadriceps muscle, then relax. Relax and contract, relax. Again, just on the side where the hip is high. For most people, this is the left side. Your therapist should help you determine if you need to do these stretches on the right or the left side. After you've strengthened the quadriceps muscles, lay down and then we'll strengthen the lower abdominal muscles. Place your hands underneath your hips and then lift the toes towards the ceiling. Contract and lift, relax. Contract and lift the toes towards the ceiling and then relax. You can do this 5 or 6 times until your abdominal muscles feel a little tired. To loosen the back, I bring my knees towards the chest and then I'm going to roll side to side. Breathe in and then exhale as you roll to the side. In and exhale. In and exhale. These are very good strengthening exercises. I do them about 25 times. Only go as far as is comfortable and go the same distance to each side. Relax and then meditate for a while before you get up. The next part of the video deals with assessment and instruction to determine which side to start the stretches on. Let's take a look first at a straight spine. You can see that his shoulders are fairly level. The head is fairly level. This poor guy has some major alignment problems. Let's take a closer look at some of the areas that we'll be dealing with. The iliac crest and lumbar spine, then on up to the cervical and suboccipital areas. The red and blue dots note muscle attachments. It is these muscles that we can utilize to pull the bones back into place with the muscle energy stretches. Let's take a look at the muscles that can contribute to the spinal misalignment. The red indicates the shortened muscles. The green indicates the lengthened muscles. The short ones need to be stretched with the muscle energy stretches. The long muscles need to be strengthened with exercises. This video deals primarily with stretching the shortened muscles to pull the bones back into alignment. So these are the neck muscles, especially the right trapezius is long, the left trapezius is tight, the right quad is often very tight, and some of the back muscles are also shortened and lengthened. The primary muscles that we're going to be stretching in the upper body are the trapezius, the levator scapula, and the deeper rotating muscles that attach to the spinous processes and to the individual transverse processes. The other distinction that is helpful to make is that the short muscles are compressed and need to be stretched with the muscle energy stretches. The long need to be strengthened. Both muscles may feel tight upon palpation, and both may have trigger points. Let's take a look at some of the muscles that we'll be stretching: the levator and the trap on the back. On the front, the pec minor has a very important role in posture. The sternocleidomastoids and the scalenes that are deep to the sternocleidomastoids are also very important. This drawing represents the pattern that I find most common in my clients: high left shoulder, high left hip, often from carrying on the left side. The right is very often used for dexterity. Right quads are tight, right hamstrings looser, left hamstrings tight, left quads need to be strengthened. On the upper, the left trapezius needs to be lengthened, the right trapezius strengthened. The deep rotator muscles also need to be loosened and strengthened. Let's take a look at one of my clients who is very typical of this alignment problem. We'll start with the assessment of the upper body. Take a look at the shoulders. Gail has a high left shoulder. Come down to the waist. You can see she has a high left hip. We'll do a little close-up of that. You can see the waistband is slanted down towards the right. The shoulder is also slanted towards the right. Let's take a look at the cervical area and the transverse processes that I'll be checking with Gail. First C6 and C7, then up higher at C2 and C3. You can check anywhere along the cervical spine, wherever you feel tension. We'll take a look at the transverse processes in flexion and in extension. If it's stuck at the transverse processes, it will move differently in flexion and extension. And by placing your thumbs on the transverse processes, you'll be able to see the difference in movement between the vertebrae. If it's stuck right here, when they flex forward, then one vertebra will ride up, or one vertebra may ride down. By checking the client in flexion and extension, you can easily see if there's a stuck vertebra. Now let's take a look at our client. I'll place my thumbs on either side of her transverse processes and have her raise her arms up. In order to locate the exact position of my fingertips, I find the spinous process at C6 and C7, and then go between those and place my thumbs between the transverse processes, and then ask Gail to raise up her arms to check her in extension. You can see my thumb on the left is slightly higher than the thumb on the right. This indicates that Gail is out of alignment at C6 and C7. I'm also going to check her in flexion to see if my thumbs move in that direction as well. Sometimes they only move in one direction. For a complete explanation, please see Rich Phaigh's Onsen videos or take one of his classes. References will be given at the end of this video. You can see a close-up of the transverse processes shows the facet joints between each vertebra. These are movable, and if in flexion they move differently, it's because one is stuck open or stuck closed. And when that happens, it puts pressure on the spinal nerves, causing pain down into the arm, into the neck. Very often, migraine headaches are caused by this as well. The real question is which side is posterior, because the posterior side will be the side we do last in order to pull it forward to even it out. Gail is posterior on the left. Next, I'll demonstrate how I instruct a client in this procedure. I'm instructing Gail to tip her chin forward and explaining how she needs to rotate towards the left last to pull her vertebra forward and straighten out her rotation. First, she'll go to the left, pressing into my hand, holding for 6 seconds, relax, and then rotate, looking over her shoulder a little bit further. She'll do this 3 times, contract, relax, and then I show her how to use her own hand so that she can do this at home. And tuck just a little bit more, great. And hold the pressure for 6 seconds and then relax and rotate and look as far over your shoulder as you can. Right. Okay, and then we're going to go back the other direction. And start here, right, rotate, hold for 6 seconds, and then relax, rotate a little bit further, good, chin down just a hair, and tip your ear towards your shoulder, perfect. Then hold for 6 seconds, pressing into your hand, then relax the pressure, tuck your chin a little, and rotate, good. And if there's any pain, you wouldn't do this. A lot of times you'll feel a mild stretch, and that's okay. And then finish with a rotation over your shoulder. Good. Okay. Great. Okay, go ahead and raise your arms up, Gail. Thumbs are staying level. That's very good. Okay, and back down. And then tuck your chin. Great. And it's still in alignment when she's forward. A little bit further tuck forward and roll your chin. Great. Okay. And back up. Twice a day and before and after you exercise, because it's the muscle imbalance that pulls that out a lot of times. So you want to exercise and strengthen it when you're in alignment. And then after you exercise, you want to do the same thing because the muscle imbalances, your muscles are habituated to being stronger on one side than the other. So,
which side is stronger?
Actually, your left side is a little bit stronger because it holds. Usually, right-handed people carry everything here, so and that's usually why they're rotated posterior on the left. Almost all right-handed people are posterior on the left. And so, let me show you how to check that yourself, though. I'm going to have you put one finger here and one finger right here. Go ahead and put your other hand back there. And right about there is where your vertebra, where the transverse processes are. So go ahead and tip your head back and then tip it forward. And when it's out of alignment, your fingers will ride differently. One will come up or one will go down. So you can see, at least if you get a headache or feel this pain back here, then check and see if you can feel if it's out. Because usually you'll have symptoms, either headache or you'll feel that pain between your shoulders or down your arm. Okay. Good. All right. Now we'll take a look at the assessment of the lower body. And to do this, we'll start with our stick figure. The main muscles that we'll be looking at in the lower body will be the quadriceps, the hamstrings, the hip rotators, and the psoas. The quadriceps are a large muscle group that attach to the hip bone. They have the ability to pull the hip bone forward. Let's take a look at the skeleton from the side view. The most anterior portion of the ilium, the ASIS, and the bump just below that, the AIIS, are two attachments of the quadriceps. A downward pull can tip the hips forward. The psoas muscle attaches to the lumbar vertebra and then to the thighs at the lesser trochanter. This muscle can also pull the body out of alignment. The hamstrings extend down to the knee and are often weak and need to be strengthened. An imbalance in the hip rotators can cause the sacrum to twist or torque, making one side posterior. First, we'll take a look at the hip bones to see if one is higher or lower than the other. To do this, we'll check the iliac crests. We don't want the thumbs underneath the iliac crest. We want to press in and then down on top. We also will check the sacral base to see if one thumb is posterior, to check the torque or the twist in the sacrum. It's helpful if we put our thumbs on the sacral base and then look down from above. We're looking to see if one thumb is posterior or closer to us. Let's take a look at our client and check her hips. Her left hip is high and her right hip is low. Next, we're going to place our thumbs at the sacral base, looking down, see which one is posterior. Gail is posterior on the left, so her hips are rotated to the left. Let's take a look at the skeleton. You can see that his high hip is left and his right leg is lower or longer. If we looked at this from the side, the right ASIS would be pulled forward, often by the quad. Checking Gail lying down, I want to see if her right leg is longer. I'll check underneath the malleolus to see which thumb is lower. I'll also check her heels to see if I can see better from that direction. Next, I'm going to instruct Gail on how to straighten out her hips by addressing her leg length difference. I'm going to have her start by stretching the hip rotators. Gail is a little tight on the right side and she can feel that pull as she leans forward. I'm instructing her to keep her back straight rather than curve it. This way she gets a better stretch. It's essential to open the SI joint before she begins stretching the quadriceps and the hamstrings. The SI joint has to be open in order for the stretches to work. Her left leg is more flexible and she feels the stretch in a different place. Have your client take in a deep breath, relax, and bend forward slowly. I'm having Gail turn on her right side with her left hip up because she was posterior on the left when we checked her sacrum. With the left leg acting as a lever, I'm having her stretch it towards the floor. As she stretches her leg towards the floor, it pulls the sacrum forward, straightening out the rotation. I have her lift, contracting, relax, and then stretching. I'm also encouraging her to keep her hip perpendicular to the table so that she doesn't twist her spine. This stretch is done only to one side. The side that is posterior is the side that you have up. Next, I'm going to have Gail stand up and stretch her quadriceps, first on the right side, her long side. Usually there's a trigger point in the right side that is pulling the ASIS forward. By stretching the right quad first, when she stretches her left hamstring, it tends to pull the ischium down, rotating the ASIS posteriorly and into a better anatomical position. So she always starts with her right quad and then goes to her left hamstring. On the other side, she needs to reverse that order. I have my client do the contract, relax stretches, pressing the leg down into the chair, holding for 6 seconds and then relaxing, bending forward straight from the pelvis. It's important not to flex the spine, but to keep the spine straight and bend forward gently. Contract, relax, and then stretch. These should be done very slowly and gently. It should never cause pain. I usually show my clients these stretches after a massage when their muscles are warm and relaxed. It's helpful to explain to the client The purpose of this stretch is to pull the hip in a posterior position and bring the front of the pelvis up slightly, thus straightening out the leg length difference. Let's take a look at that with our model. The PSIS and the ASIS create an angle steeper when the quad is tight. When you loosen the quad and strengthen the hamstrings, the angle straightens up. 0 to 5 degrees is normal for men, 5 to 10 for women. The other side, Gail will start with the hamstring stretches. Compress, hold for 6 seconds, relax, and then stretch. After the hamstring stretches, she'll do the quad stretches to pull the left ASIS forward to balance the pelvis. It's stretching in the opposite order. First quadriceps, then hamstring, and on the other side, hamstring and then quad. That creates the torque and straightens out the hips. After she's finished with the hamstrings, then I have her do the quads on the left side, emphasizing to point the knee down as straight as possible without arching the back. Tucking the hips under also helps stretch the psoas better. If the psoas is tight, I'll show them the stretch at the end of the table with knee to chest on one side and the other leg hanging over the end, as demonstrated in the previous part of the video. After she stretches her quadriceps, I'm going to recheck her alignment. The hips look better. The shoulder on the right is still a bit low, and that probably needs strengthening. I'll check her rotation, and that also looks much better. Then I'll have her lay back down and recheck her ankles to see if the malleoli are aligned. And hers look much better, though Gail is only slightly off and somewhat difficult to tell. Her malleoli look even. I'll check her ankles and her heels, and they look better as well. If I don't get a correction with these stretches, I may need to correct the pubic bone. Sometimes the pubic symphysis is misaligned. You can squeeze a beach ball or a pillow between the knees to open up the pubic symphysis and help it to realign itself. Now let's move on to another population. Children have symptoms of misalignment too. Headaches, stomach aches, cold sores, colds, and other symptoms of stress often occur more frequently when they are out of alignment. So this is Dax Poston. He's our helper today. So Dax, is your shoulder sore today?
Yeah.
Okay, so I want to check your alignment. Let me have you turn around, face the screen. Okay, and I'm going to have you raise your arms up over your head.
Okay, let me zoom
Very
in.
good. Okay, now hold them like that for just a minute, because your dad's going to zoom in.
Okay.
And then lower your arms back down. Good. Now sit up real straight and tuck your chin down. Good. And then back up. Okay. Now I want you to try tucking your chin a little. Tuck your chin. Yep. And then press into my hand and hold for 3 seconds. And then look over your shoulder. Press and then look over once more. Good. Now let's go the other way. Press and rotate. Press. Tuck your chin down a little more and rotate. Good. And rotate. Look over your shoulder. Good. Okay, now I want you to sit on this hand. Yep. And then kind of stretch your head that way. Does that feel like a good stretch?
Ow, that hurts.
It hurts there?
Yeah.
Okay, just stretch it as far as it's comfortable.
Get there.
There's good. Okay. And then press into my hand. Up here, actually, yep. And then relax. Okay, and now see if you can bend your head a little bit further. Good. Okay. All right. Now, let me have you sit up real straight, and then lift your arms up once more. Okay, and back down. Okay, and this time lift your arms straight in front of you, about halfway. Yeah, there. Now a little bit further, a little bit higher. All right, good job. Okay, now let me have you lay down. Okay, and try to be real straight on the table for me. So move over just a hair. Yep, perfect, perfect. Okay, now do that thing where you bend up your knees and lift your hips off the table. Good, and then back down and then straighten your legs out. Good. Okay, now I think you need to be up just a little bit higher. Maybe not. Okay, yeah, that's good. Okay, now bring your feet up a little, Dax. Now pull your toes towards you. Pull your toes towards you. Yeah.
Okay, that shows pretty good right there, the unevenness.
Okay, good. All right.
Okay.
Okay, so you're going to do the figure 4 stretch and just pull that up as right there. Is that comfortable? Just so you feel a good stretch right there. Good. And now switch legs and do that to the other side. Yeah, that's good. And then up. Okay. All right, now then. This was a long leg, so what we're going to do is have you lay down, turn over face down. What we're going to do is stretching the quads. And is that a good stretch, Dax?
Yeah.
Push against my hand. Try to straighten your leg that way. Yeah, push. All right, good job. Then relax it. Let me stretch. Good. Push once more. And relax. And let me stretch it. Good. Okay. Now, just gonna see which way you're rotated. Okay. Good. Okay. Now, let me have you turn over face up. And then I'm going to stretch this way. You keep your knees straight. Okay. And you say when is a good stretch. Does that feel like a good stretch?
Yeah.
Okay. And press against my hand. That's good. And then relax. Relax. Totally relax. Relax. Okay, not relax. No. If you were relaxed, it would. No, you gotta relax. Bend your leg. Yeah, there you go. Now straighten it up. Yeah.
There.
That's a good stretch, huh? Okay, press down once more. Try to lower your leg. Okay, you don't do it so hard it hurts. Now relax. Okay, now let me straighten it. Good. Okay. Now let's do the other side. We're going to do that same stretch this way first. Okay. You say when. Is that a good stretch?
Yeah.
Okay. Now press down. And relax. Relax. And let me straighten it. Press down. And relax. And straighten your leg. Oh. Okay. Now, other side. Flip over, yeah, that's good. And then we're going to stretch this way. And then press. And relax. And press. And relax. Okay, good. All right, now let me have you lay on this side. Facing the camera. Yep. Completely on your side. Yep. And slide to the edge of the table. Okay, but you have to slide all the way through. That's right. That's good. Okay. Now, drop your leg over. Just the one. Just the top one. Yeah. Now, let me stretch that. Is that a good stretch?
Yeah.
Put your hand under your head for me. Yeah. And then press into my hand. And relax. Okay, relax. And then let it hang down. Good. Okay. Now, let's check your legs. And see. Alright. Can you straighten out your toes? Okay. Now, bring them out a little. Okay. All right. It's better. Thank you. Good job, Dad. Alrighty. This next stretch is for the quadratus lumborum and the latissimus dorsi. I get in a lunge position, supporting with my arm, and then lean to the side. You can do this to both sides, or you can just do it to the side with the high hip. The next stretch is also for the quadratus lumborum. I stand about a foot away, my arm is up, and then I lean in towards the wall. Do this only to the side of the high hip.